According to the latest coroner's report, Northern Ontario saw the highest mortality rate from opioids of anywhere in the province during the pandemic. And in addition to that terrible loss of life, there are the daily realities of the toll that addiction takes on everyone. How are public health and the respective communities dealing with all that? Let's ask. In Thunder Bay, Ontario, Cynthia Olson, Manager of Community Strategies and the Drug Strategy Lead for the City of Thunder Bay. In Timmins, Ontario, Dr. Leanne Catton, Medical Officer of Health and Chief Executive Officer for the Porcupine Health Unit. In Sault Ste. Marie, Ontario, Hilary Cutler, Manager of Community Wellness for Algoma Public Health. And in Sudbury, Ontario, Dr. Penny Sutcliffe, Medical Officer of Health and Chief Executive Officer for Public Health Sudbury and District. Thank you all for being here with us tonight to speak about this really important topic. Usually when we start the show, we start with data and numbers, but I'd like to show the viewers something a little bit more visceral. Penny, those crosses are located in Sudbury. Can you tell us about them?
Yes, these are crosses where the mother of a young man who died in Sudbury from the drug toxicity first put a cross to bring attention to this issue some 2 years ago, expecting that perhaps there might be a couple more that would go there. I think it's risen to about 244 crosses now, tragically, of individuals who have died in our community, sons, daughters, sisters, neighbors, from the toxic drug poisoning crisis in our area.
And you mentioned sons, daughters. These are our family members, our community members. How important is it for us to keep that in mind instead of just looking at the numbers?
Oh, thank you for saying that. It is incredibly important, and this is such a poignant notice and symbol for our community. It's in a busy section in downtown Sudbury, lots of support from a city council that it be there as a reminder about the huge impact and the toll and the people behind those tragic numbers and the statistics that you're referring to.
We do have some numbers to look at just to give people a sense of the urgency of this issue. From April 2021 to March 2022, the Thunder Bay District Health Unit had an opioid death rate of 82 deaths per 100,000 people, more than 4 times the provincial rate of 18.7 per 100,000. 5 other health units in northern communities also topped the list of opioid-related deaths. The second year of the pandemic, Public Health Sudbury and District had a rate of 53 opioid-related deaths per 100,000, and Algoma Public Health in the Sault Ste. Marie area, a rate of 52 per 100,000. North Bay Parry Sound District Health Unit, 41. Northwestern Health Unit in the Kenora-Rainy River region, 40. Porcupine Health Unit saw 34 deaths per 100,000, respectively. Hilary, can you give us a sense of why opioid deaths are happening at such alarming rates in Northern Ontario?
Yeah, and I think it's important to recognize that health disparities are greater in northern communities compared to southern communities. We have greater rates of poverty, homelessness, and as we are seeing with the opioid poisoning crisis, higher rates of substance-related harms. And a very important part of this conversation is the fact that our health outcomes are greatly influenced by social and economic conditions. These are what we call the social determinants of health. They are non-medical factors that influence our health. They include income, education, early childhood development, access to services, to name a few. So when we look to the social determinants of health, we can then begin to understand how issues such as trauma, limited access to services in rural communities, colonialism in the north, and simply stressful life events can then lead someone to substance use initiation, and thus the vicious and dangerous and tragic cycle that we are seeing with the opioid poisoning crisis.
Leanne, Hilary mentioned the social determinants of health. People may be finding ways to cope with their lives because of the things that they have to navigate on a daily basis. It's a tall order to deal with the crisis at hand and also to address poverty, childhood trauma, being unhoused. To what extent is your jurisdiction able to cope with a crisis, let alone to prevent it?
It's an incredibly important question, and exactly what Hillary mentioned is where public health does need to focus our time and energy. We really continue to strive to work and increase priority in the area of prevention, of ensuring that we have safe, connected, healthy communities, that we're supporting the policies and the processes for early childhood development, that we're looking at housing, we're looking at income, that we're looking at trauma-informed care, and all of the items that really we know impact substance use and lead to this tragic outcome that we continue to see. And you're right, it's challenging in the middle of the crisis that we're seeing to make sure that we're putting that time and energy and that we really continue to see the funding and priority in prevention and upstream measures to really address the social determinants of health and the complex factors that really lead to the crisis that we're seeing currently.
Did the pandemic make the situation worse with the opioid crisis?
Definitely. I think we saw that clearly across Ontario. We know that individuals tended to be using alone more often. We know that support systems were broken or sort of not available as they had been prior to the pandemic. And so we definitely saw that in the numbers and the tragic losses across the province and across our region, and definitely something that we need to continue to focus on the upstream prevention and also ensure that we have the emergency supports in place to save lives while we're working on the comprehensive approach for all of this.
Cynthia, during the pandemic, we were obviously, at some point of the pandemic, we were kept apart to keep us safe. People lost their livelihoods. There wasn't that, a lot of the resources that we had were focusing on helping us navigate during this pandemic. Many drug strategies have 4 pillars: prevention, harm reduction, treatment, and enforcement, but Thunder Bay has a 5th. What is that 5th pillar, and why is it so important?
Yeah, thank you for that. We in the consultation period in our community when we were developing the drug strategy, it was loud and clear that housing needed to be at the forefront as well as part of a comprehensive strategy. I mean, I think certainly you've heard from the other guests tonight that the social determinants of health are really, really critical. And our community felt that in order for people to get well, you really needed to have safe, affordable, and stable housing. And so that's why we embedded the housing pillar within the other pillars for the drug strategy in the community.
Hillary, we're talking about housing. We're talking about the urgency of combating. It seems as if every day we turn on the news, something new is happening, and our resources that we have need to be directed to something else. What would you say are the social and economic policies that we should be looking at for the longer term solutions?
Oh, and in response to that question, I would say that it is across multiple sectors and it's multiple partners at the table discussing and collaborating at the local level and at our northern level as well, what might be most appropriate. I will say that it does span across housing, it spans across childcare, entry into the workforce, income, for example. I know there was a pilot for what a basic income could look like in Ontario. And all of those things need to be on the table when we're talking about systems and structures that we can put in place to support people economically and socially.
And Penny, we've heard before of situations where doctors prescribe people with medicine that they end up being addicted to. What would you say is causing the situation we have right now?
Well, that's really interesting because we know that we understand that earlier on in this crisis, a lot of the situations were as a result of prescribing for pain and then individuals becoming addicted and then looking to street supply when they couldn't access that through their healthcare provider. I think less and less, we are seeing much less and less, we are seeing prescription medications involved in opioid poisonings and really the street supply. And so, although, of course, it's incredibly important that there is appropriate pain management and there are excellent Canadian guidelines supported by the associations within Ontario, very, very important. But we also know that, in fact, it is the toxic street supply, this toxic, unregulated supply that is killing people. So it's an important avenue. And the other thing I might reflect upon with your previous questions is that this is a messy, complex problem that is going to take, messy, complex solutions. And we really do need to think out of the box. We need to, all of us, see ourselves in the picture and as part of the solution, because it's not a simple fix. It's not a vaccine. It's not a one strategy with prescribing, et cetera, but all of these many pieces combined together that will ultimately see us having some success. It's tragic all over, and particularly so in Northern Ontario.
I just want to follow up with you, Penny, on that. You used the term messy and complex. When you say that, what do you mean?
So if we think about a problem, so even COVID, which has not been not complex, but we know that the vaccine has been a really tremendous strategy, and certainly the public health measures that were put in place that helped to protect us all. This issue, as has been highlighted by the other speakers, the other guests, the social and economic determinants of health, right from, how do we prevent the push and the pull, the draw to use drugs in the first place, to how do we actually help people to reduce the risks if they are using, so that they're not dying and there are further reductions in risk to their families, to their communities, and obviously to themselves. So things like the work that we do in schools and resiliency, connecting the dots between that work and the ultimate goal, in this instance, of reducing the risks of drug use. The enforcement pieces with the drug suppliers in the first place, the toxic supply and thinking about safer supply, or the status of the criminalization of drug use. All of these things together really make it a very complex and a very messy problem, and I think a very difficult problem for policymakers to also get their minds around, to think about what are acceptable solutions, where are our values, how do we value people who use drugs, and how do we make sure that we have all hands on the table to do what we can to reduce the risks.
We are going to get into some of those solutions, and some people say that these solutions can be controversial, because I still do think that there is a certain amount of stigma on around drug use. But one of the solutions has been to have safe injection sites. And Sheldon, you already have a 4-shot, but I wanted to get an idea from all of you. How many of your regions have safe injection sites right now? If you can just show a raise of hand. Kind of? Okay, we'll come back to that. But Leanne, I want to come to you. Vancouver has had a safe injection site since 2003, almost 20 years. Why has Ontario been so slow with safe injection sites?
I think it's a really good question. And part of it, I really do believe, is the timeline of the crisis as we've seen it sort of move across Canada. It's an important indicator, and I think something we're able to learn from the tragedy and the outcomes and the lessons learned in BC. But really, when we look at 2015 and 2016, the numbers in BC, when they declared the public health emergency for the opioid crisis, their numbers were much higher than what we were seeing in Ontario at this point in time. They also saw an earlier increase in the toxic poisoning of the drug supply with fentanyl and other opioids. And so we're seeing those numbers in the last few years, and definitely following the trends that have been seen there. And I think that is a part of it, but important to recognize that that we can learn from the unfortunate tragedies that they've seen there. And I think we are and able to move quickly.
I think one of the things that happens is sometimes when we have these conversations is that we assume that everybody knows how these things work. So Cynthia, you have a treatment site. Can you give us an idea of how that works?
Yeah, sure. It's operated through a community health center in partnership with the Legal Initiative Family Care. And really, it's open 7 days a week, and individuals can connect in for service. They don't have to use the supervised consumption component of the service, and we're actually seeing a large number of individuals, connecting for other health and social services within that setting. But they're able to also connect with a healthcare provider who would oversee them using their substance. So right now it is generally by injection. Typically in Ontario, I don't think there's any supervised consumption site that actually permits safer inhalation inside, which we know is also a challenge. And then individuals are then monitored and able to be responded to in a very timely fashion if they do experience symptoms of an overdose. We know in our own local supervised consumption site that there have been overdoses, and that those have increased over the years, certainly as we've seen a toxic drug supply coming into the community, but not a single death. So that means that people are well connected and being able to be responded to, and then are well engaged in the treatment services and harm reduction services in a community.
Can you expand on that? Because I think the why that is needed. Because some people might say, well, you shouldn't be doing drugs in the first place. But why is it important to have a site like that?
Because people matter. Like we talked about right at the outset, you showed the crosses. This is people's family. This is our community members. This could be my brother. This could be your sister. People matter, and if we don't save lives, there isn't a possibility for them to get well. And we know that the recovery is possible as well. We're talking today in Recovery Month across Canada. It's really important that we give opportunity and connect people to the services that would make a difference in their lives.
And Leanne, is there also a part of the acknowledgement and the acceptance that people will be using drugs?
I think for sure. I think it's similar to other health activities that people undertake for one reason or another that may not be the most healthy for them, and we need to understand that individuals have faced tremendous, hardships, and as we mentioned, really needing to address the root causes and the complex factors, as Penny mentioned, that really can lead to individuals using substances, and making sure that we have those wraparound supports and services. And I think the most important thing that Hillary and I think all of us has said is, these are people, these are community members, these are loved ones, and we don't have this same hang up about other medical conditions. And it's really, really unfortunate, because I think it drastically impacts people's ability to admit that maybe they need help before they even use substances. It drastically impacts people's ability to reach out for supports and services that they do need. And unfortunately, it often impacts our abilities to have conversations and open our minds to what needs to be done. As Penny mentioned, it's not easy. And we really, it's all of us. We all play a role, whether we're in public health, whether we're in education, healthcare, social services, mental health, or addiction counseling. Every single community member has to be on board in order to save lives and in order to prevent this from continuing to increase.
Well, Timmins has a new safe injection site with over 600 visitors in your first month. How hopeful are you that the death rate will come down now that you have that site?
I'm very hopeful. I think we have to have that hope. I think the other thing to keep in mind is that we have to continue doing all of the other work. As mentioned, we need to continue to address the inequities, the social determinants of health that the population faces. We need to continue to ensure that we're looking at supports for individuals when they stop using, once they do access the support and services that they need. And I think the other important indicators that we see with safe health sites, such as Safe Health Site Timmins, is that we know the evidence is that it saves lives. We also know that the impacts of connecting people to supports and services is critically important. And so beyond the visits for actual consumption, as Hillary mentioned, really making sure that people have an opportunity to connect with others, that they're seen, that they're heard, that they can be referred to addiction and other services, as our site has been able to do over the last couple of months, as well as ensuring that people have access to medical care. We're able to share local, alerts or trends, make sure that people have other supports, even food, water, snacks, washroom. It's really an integral opportunity to connect with individuals who use substances while working on saving lives as well, obviously.
Hillary, your region is the only one that doesn't have a site. Would you like to have one in your region? Would it help?
We do agree. Yes, of course it would help. There is an acute need for this service, and there are people who would use it. And to speak about some of the points that were just mentioned around stigma, when we think about this opioid poisoning crisis from the lens of human suffering, rather than the substances that people are using, our frame and our approach becomes more compassionate, more empathetic, and this can go a long way towards reducing stigma in the community. which is why an understanding of the social determinants of health is very important. So much happens in someone's life before they need to step into a treatment center or before they need to seek services. And our work must incorporate an understanding of this and the collective actions to address those social and economic conditions. So certainly those sites are part of it, and we do support such a site in Algoma. We just don't have one at this time.
You mentioned stigma because I know there's even within Toronto, there's still stigma on just drug use itself. Do you think that maybe we need to have more open conversations about the prevalence of drug use in order, if people do need help, they know that they can actually access that help? Hillary?
Yes, yeah, I do think the conversation needs to continue at all levels, and it needs to be informed by the people who are in the system experiencing stigma themselves, and that is something that I think my northern colleagues have undertaken or conducted with their partners, similar to us in Algoma. We are currently speaking with people who use substances to understand barriers to recovery or wellness, and also understand the stigma that they face in our community so that we can honor their voices. They've had courage to speak with us and amplify this message so that others in the community can understand the crux of stigma and what it really means and what it really looks like. And these personal narratives will go a long way. So the conversation does have to continue at multiple levels.
Penny, you said you kind of have a site because it's not open yet. You've talked about a safe supply. Offering a safe supply can be seen as kind of a controversial topic. How would we even start that type of program when we're so behind on safe injection sites?
Mm-hmm. The drug supply is toxic, it's unregulated, and it is killing people. And so I think labeling that, naming it, surfacing it, and having really straightforward conversations about that fact and what are the solutions to deal with that fact. If we had alcohol that was contaminated and was killing people, we would do something about that. People are using drugs. Whether we have values associated with that or judgment or stigma is beside the point. It is a fact, and so one of the measures certainly would be to look at safer supply. I'm not an expert in this area in the slightest. However, we are familiar with other jurisdictions where this is being tried. It is one of the tools in the toolbox in combination with all of the others that have been discussed today. I really think that, especially in the north, where our death rates, not even going to emerge or EMS, visiting sites, etc., the death rates, the tip of the iceberg, is 2 to 3 times higher than the rest of the province. It is killing people. And so to my point earlier about it's messy and it's complex, but with that, we also need to make sure that we look out of the box and do not turn away any solution as a possibility, but really have a very, very close look at all of them. Keep all the doors open to consider what might be an effective solution for the north, both from the prevention end, as our colleagues have spoken about, through to the harm reduction end being safer supply and or safer use opportunities. It's a crisis. It's very, very critical.
We have about 5 minutes left, but I just want to follow up with something, Penny. You've called this an opioid poisoning crisis. Why poisoning?
Well, because most of the vast majority, over 90% of the deaths are not intentional, they are accidental. And it is because people who are using drugs, and we absolutely need to include them as a really important part of this conversation. I might encourage you to think about that for your show in the future. But persons who use drugs are not looking to die. It's accidental. They do not know what is actually in the substances that they are taking. So these are drugs that people are using that are being poisoned. The quantity and the quality are unknown for people who are really suffering from a medical disorder or a disorder in terms of addictions, who deserve and need better treatment.
Cynthia, we've heard of stories of people using just one time and then them dying. What are your thoughts on providing a safe supply?
Well, we're actually fortunate. We just had an announcement that a safer supply program will be launched here in Thunder Bay. I think it's really critical. for individuals who are maybe using recreationally or one-time use, that may not be the best option. I think there needs to be a broader conversation about regulated drug supply across the board. But right now, the safer supply programs are really targeted at individuals who are really in acute need based on their level of substance use and the level of harms that they're experiencing because of it. They're generally quite small. But I think it goes hand in hand, like we've been talking about, a comprehensive continuum of options in a community. We need, alongside that conversation, we need to have the conversation about decriminalization or safer supply on a more broad scale. I think one of the guests talked about alcohol, and we have an opportunity with the way alcohol is regulated that you can issue an alert when something has gone wrong with that because it's regulated. There's there's checks and balances. We don't yet have that option. And so it's really incumbent on communities right now to be monitoring and relying on intel from community partners when there might be a spike in toxicity in their community and sending out alerts.
Hillary, I'll let you have the last word. Where do you find hope? We hear all these numbers. Where do you find hope in those numbers that point to this crisis being worse and made worse by the pandemic?
That's a complex question, and I think that there is always hope. Anyone who is working in this field and wants to help people, because it is at the core, it's about humans and helping each other. So, there is hope in that the conversation can continue. We can continue to work on stigma. We can continue to work with our policymakers at the provincial level to just be mindful of the social and economic issues that affect health, and together as a community and as a northern region, we can just do our best. It is all about working together, and I think that there's just simply hope in that. So those would be my final words on that.
I really do appreciate all of your time and expertise on this. We really do appreciate it, and we send our thoughts to all those families that have been impacted by this during this crisis. Thank you so much for your time.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.